Again, real quick, Kelvin, I just think, and tell me if I'm wrong, that I feel like a lot of the younger people that text or on the computer, I think they've learned or have not mastered a lot of skills in speaking. And I
Yeah.
just feel like sometimes the pet owners, they're gun shy. And I even have a couple of my younger doctors, they really don't like to go in the exam room because I think they're not comfortable with their conversation. And of course, the biggest thing is that you get right out of school and you want to use all these big terms. I mean, you've heard it for 4 years. And of course, you say too much medical jargon, and most
Yeah.
people aren't going to acknowledge and say, oh, I don't know what you're saying, but they won't understand what you're doing. So for all the years I practiced, that was always one, try to speak to their level because, they haven't had the experience or
Yeah.
education that we've had.
Yeah.
And so, but now I think there's even more complications with the way, especially younger people communicate.
No, I
They
think that would be a topic that we should dive deeper on, because if the communication is there with the patient that can clearly explain of like what the situation is, or they have a better understanding, I think that's just better for everybody involved.
We'll invite some younger people and see if I can get their thoughts on communication with pet owners.
Yeah.
Because I truly think that, in my opinion, that's a problem. But I think if I get some younger people, maybe we can, for all the listeners or observers, they can maybe get a better perspective.
Oh, 100%.
Different generations and how we try to communicate or not communicate with the pet owners.
We just need to do a little bit of convincing.
I think communications for all of us is an obstacle trying to explain something to a pet owner.